Hi everybody. The case that I chose to do my abstract case report on is duplex evaluation and diagnosing of chronic mesenteric ischemia. The study was performed by Mark Cloysa, RVT, and signed and read by the surgeon, Dr. Jason Slikeu. The patient is a 54-year-old male with a history of high blood pressure, high cholesterol, diabetes, and is a current everyday smoker. The patient arrived to the vascular office with an abdominal pain with eating, weight loss, and food fear. The patient states he experiences pain within 30 minutes after eating a meal, causing him to fear consuming food. He also states he has lost a total of 30 pounds in the last 6 months. Duplex evaluation of the patient's mesenteric arteries reveal evidence of mesenteric ischemia, also confirmed by a CTA of the abdomen and pelvis as shown in the images to the top left corner of the poster here. The middle images of the poster reveal an occluded SMA with evidence of collateral flow in the mid to distal portion. Grayscale image here showing the occlusion as well as color, showing the collateral flow as well as the occlusion with no color. The image in the middle on the bottom reveals a high-grade stenosis in the celiac artery with a velocity of 635, and that is down here. And the images on the right side of the poster reveal an enlarged IMA with evidence of stenosis with a velocity of 327. The first image here shows the enlargement with a measurement as well as the velocity down here. The last image I wanted to discuss was the picture of the waveforms on the bottom left-hand corner of the poster. Here. A normal duplex with the patient following protocol and not eating for 8 hours prior to the examination would reveal an SMA to have qualities of a high resistance vessel with a high peak systolic and low end diastolic as shown in the first waveform here. The second waveform pattern reveals a vessel with a low resistance and more continuous waveform. This is due to the SMA working and needing more blood or constant flow to help them with digestion. The results of the duplex evaluation all point to chronic mesenteric ischemia, a difficult disease to diagnose. According to Pellerito, severe compromise of at least 2 of the 3 vessels is required for symptoms to be present. And as shown here with this case, the male did have actually all 3 of his vessels that were compromised. And differential diagnoses of the chronic mesenteric ischemia that contribute to difficulty with diagnosing include intestinal obstruction, cholecystitis, appendicitis, and cancer. Due to the patient's symptoms, duplex evaluation of the mesenteric arteries, and the confirmatory CTA of the abdomen and pelvis, the patient was diagnosed with chronic mesenteric ischemia. The duplex revealed that the celiac artery had a high-grade stenosis, the SMA appeared to be occluded with collateral flow, and the IMA also revealed to have high velocities in stenosis. Due to the patient's symptoms and testing, the surgeon recommended urgent surgical intervention for celiac and IMA, the recommended intervention being mesenteric angiogram with possible revascularization being angioplasty and or stenting of the celiac and IMA. And that was my presentation on duplex evaluation and diagnosing of chronic mesenteric ischemia. And the 2 questions that I have for you guys would be, why would the IMA measure larger in the presence of stenosis and or occlusion in the SMA? And second, where could the collateral flow be coming from that is feeding the mid to distal portion of the SMA? Thank you.